Dengue fever is the most common and important arthropod-borne viral disease in humans. It is transmitted by the mosquitoes of genus Aedes. Two species of Aedes mosquitoes have been identified as vectors of dengue virus: Aedes aegypti and Aedes albopictus. These mosquitoes are widely distributed in tropical and subtropical areas, and most recently, in more temperate areas. Dengue is a serious disease which affects more than 120 countries in the world. In 2019, it is named as one of the top 10 threats to human health by the World Health Organization. Disease spectrum can range from a mild flu-like illness, which is usually seen in classic dengue fever, to a severe, life-threatening disease called severe dengue, which is previously known as dengue hemorrhagic fever. And it is characterized by coagulopathy, increased vascular fragility and permeability. If not closely monitored and managed, hemorrhagic fever is more likely to progress into a state of hypovolemic shock, which is known as dengue shock syndrome, or DSS. Dengue virus belongs to the group of flaviviruses, which contain a single-stranded, non-segmented RNA molecule as genetic material. There are 4 serotypes of dengue virus have been identified, and several serotypes can be in circulation during an epidemic. Infection with one serotype gives a lifelong immunity against that particular serotype. However, secondary infection with another serotype can cause severe dengue and dengue shock syndrome within the same person. Ultimately, an individual could be infected by all 4 serotypes of the virus. First, let's see what are the signs and symptoms of a dengue infection. Incubation period of the virus is about 4 to 10 days on average. Following onset, symptoms usually last for about 2 to 7 days. Many patients with dengue virus infection are asymptomatic. Approximately 1 in 4 people with dengue infection become symptomatic. Symptomatic infection commonly presents as a mild to moderate, non-specific acute febrile illness. About 1 in 20 patients with symptomatic disease develop severe dengue. Most of the time, these patients have a history of a prior dengue infection. There are 3 phases of the clinical course of a dengue viral infection: febrile phase, critical phase, and convalescent or recovery phase. Let's discuss about them in detail in the following sections. First, let's discuss about the febrile phase. High-grade fever is the predominant symptom in this period. In addition, patient may complain of severe headaches, along with retroorbital pain, severe arthralgias, or joint pains, severe myalgias, or muscle pain, bone pain, and some people may present with a macular or maculopapular rash, predominantly seen on flexor surfaces. In addition,